Mr. Comer, and thank you, Director Gupta, for joining us today. The committee is going to be facing in the coming weeks the reauthorization of your office, which plays a critical role in the executive branch coordinating a whole of government response to reduce drug addiction and to prevent overdoses, which touch nearly every family and certainly every community in the country. Overdose deaths have reached record levels in recent years, and while deaths remain shockingly too high, we are making progress reducing their frequency, partially because of the work of your office. Without ONDCP's coordination and oversight of drug policy and strategy, our public health and law enforcement agencies would still be working myopically in silos, and federal investments to tackle the problem, totaling $41 billion in fiscal year 2022 alone, would be drained off into waste and inefficiency. Instead, because of your office, our federal agencies collaborate to address the problems of addiction and overdose as part of a well-focused national drug control strategy. This comprehensive approach means that we can better deploy federal resources to help the communities hit hardest by trafficking and the staggering rates of addiction, including by working to keep drugs out of the hands of children and to make sure people experiencing overdoses have access to life-saving overdose reversal medication. After rising for more than 2 decades, overdose deaths in America skyrocketed to historic highs during the coronavirus pandemic, when they increased by more than 30% in 2020. The rate of increase slowed to 15% in 2021 and then again in 2022. While overdoses remain far too common and a single overdose is too many for our people, we have made remarkable strides in the last year, and new CDC data show opioid overdose rates plateauing for the first time in many, many years. But we cannot continue this progress without reauthorizing your office. Democrats and Republicans should work together to address the underlying causes of addiction in our society. When we talk about the opioid crisis or the fentanyl crisis, we're really talking about many different social crises bearing down upon us, including the mental and emotional health crisis, and in many communities and regions, an economic and opportunity crisis. It does no service to our communities and our families harmed by addiction to completely blame opioid overdoses on a crisis, whether real or fake, at the southern border. We're talking about more than 40 million people in America who have substance use disorders, with many of them facing serious underlying mental health conditions. We're talking about people who lack the resources they need to treat mental illness, who face stigma in obtaining treatment, and who may self-medicate with alcohol, fentanyl, and other illicit drugs. More than 100,000 of our constituents, family members, and friends lost their lives to drug overdose last year. We must reauthorize ONDCP to ensure that America's young people have access to treatment, both for substance use disorders and other mental illnesses, so they do not end up overdosing or going to prison for committing drug-related crimes. More than 60% of children who experience depression do not get the treatment they need, which exposes them then to the temptation to use dangerous substances to self-medicate in the absence of the mental health support networks that could actually see them through to safety. We have to reauthorize your office to halt the flow of fentanyl into our country. Thanks to the work of ONDCP and the entire administration, U.S. Customs and Border Protection seized nearly 245,000 pounds of illicit drugs at the southern border, including 21,000 pounds of illegal fentanyl from March 2022 through February 23. Because we now have a coordinated all-of-government response, we're seizing more fentanyl before it invades our communities, and we're ensuring that law enforcement agencies have the tools they need to arrest illicit drug traffickers. We are disrupting the criminal cartel networks that operate from China to Mexico and have denied nearly $2 billion to the manufacturers and traffickers. Under ONDCP's leadership, the High-Intensity Drug Trafficking Areas Program is working effectively, and in 2022, we saw a return on investment of $82 for every dollar put into the program. The office is working with our Homeland Security agencies to ramp up the use of high-tech device drug detection technology along the southern border, including installing new non-invasive scanners to catch trucks entering with fentanyl into the country. These new technologies appear to be working in dramatic fashion because fentanyl seizures are up nearly 400% along the southern border, and 90% of illicit fentanyl is now being caught at ports of entry and vehicle checkpoints. Earlier this month, your office released the nation's first response plan for fentanyl adulterated with xylazine. After designating the substance an emerging threat, ONDCP would not have been able to make this designation without new authorities granted to you during reauthorization in 2018. Because of the new designation, ONDCP can coordinate a rapid response to the drug by surging resources to state and local entities combating the threat in real time at street level. We cannot efficiently address the addiction and illicit drug control problems we face without discussing both supply and demand. While blocking fentanyl, methamphetamine, and other dangerous drugs from entering America is crucially important, we must also address the prevalence of untreated mental illness and rampant drug use, which create a market for these drugs in the first place. And significantly, we must also ensure that people who experience drug overdose can get access to the emergency medications they need to save their lives. Thanks to the bipartisan, bicameral work of this committee and others in Congress, the naloxone and opioid overdose reversal medication is set to be available over the counter in just a few weeks. And thanks to the good work of your office, more of our schools and workplaces have overdose reversal medication readily available. We must continue our work to ensure these medications remain affordable and accessible, where they can mean the difference between life and death for our constituents. Dr. Gupta, I look forward to hearing from you today about your critical work, and I thank you for joining us for this hearing as we work to reauthorize your office. I yield back, Mr. Chairman.